Welcome back to the latest on the COVID-19 update, where the good news or the positive development in the fight against coronavirus is coming from the United States today. Pharma giant Moderna has stated that its vaccine has proven to be 94.5% effective in preliminary data from the company's still ongoing study of 30,000 volunteers. The vaccine's efficacy rate is based on the results of 95 cases, of which 90 cases claims Moderna have proved to be successful by the NIH-appointed Data Safety Monitoring Board. 30,000 people have enrolled for Moderna's vaccine trials called COVE study. Moderna's results come exactly a week after Pfizer announced that its vaccine proved to be 90% effective in the trials.
It's a really important milestone in the fight against the pandemic because it demonstrates that our vaccine, mRNA-1273, is able to prevent COVID-19 disease, including severe disease in people who've received it. It's really just a milestone, though. We have a lot of work ahead of us. Knowing the vaccine is going to be effective is great news, but we still need to complete the regulatory process, which involves completing the study and generating more data, even some follow-up and safety data. And then, of course, we need to get busy manufacturing.
And the vaccine couldn't come a moment too soon at a time when the national capital is witnessing a huge surge in its daily coronavirus cases. Delhi, in fact, is now the city with the highest daily rates of coronavirus cases in the world. India Today's Ashutosh did a reality check. Here's his report.
It is Delhi's biggest battle. A massive spike in COVID cases and rapidly dwindling hospital beds. No city, not even in the United States, is seeing the growth in COVID cases that the national capital is seeing. Since November beginning, Delhi's COVID numbers are among the 10 worst globally. Delhi's current average daily new cases dwarf even cities like New York and Sao Paulo in Brazil. Seeing the dire situation on the ground, the centre has joined forces with the Delhi government. Paramilitary medical staff are being airlifted to the capital to counter shortage of doctors in Delhi. The Delhi government remains hopeful of containing the COVID crisis.
फर्स्ट वेव जून में आई थी, सेकेंड वेव सितंबर में आई थी और थर्ड वेव ये जो नवंबर में चल रही है, इसका पीक तो जा चुका है. आज मैं कह सकता हूं, डेफिनेटली आपसे कह सकता हूं कि डेफिनेटली वेव का जो पीक था, पीक इज गॉन. अब धीरे धीरे ये कम आएगा.
Of particular concern is availability of ventilators. Of the 1,342 ICU beds with ventilators, only 165 were available in the evening, according to the Delhi government's COVID beds dashboard. Private hospitals are the most in demand. Delhi's Sir Ganga Ram Hospital has no ICU beds available. Same is the situation at top private hospitals like Indraprastha Apollo and Max. Even the Lok Nayak Jayaprakash Narayan Hospital, the biggest COVID facility in Delhi, has 8 ventilators left, though beds are available.
During the meeting with the state and centre at MHA headed by the Union Home Minister Amit Shah, the centre has assured to provide ICU beds, 700 ICU beds fully equipped. Looking at the number which are in a surge in the capital for last few days, there will be more need of ICU beds. But at the moment, where the government says it has available of beds and wards around 7,900 in its own stock, private hospitals have wards, but there is lack of ICU.
The centre is now rushing to add 750 ICU beds to capital's existing capacity. Much of it will go to the 10,000 bed COVID centre. With Ashutosh, Bureau Report, India Today.
Joining me now is Dr. Rakesh Verma. He's additional superintendent. He's with the Delhi Additional Director General Health Services, Ministry of Health. Joins me. Appreciate your joining us, Mr. Verma. Dr. Verma, I want to ask you the big question that's troubling many people. Is it really, as is being suggested by the Health Minister, that the wave has peaked and now we will see a decline? Is that what is being suggested? Because the numbers are still very, very high in Delhi and indeed across North India. Is this going to stay with us through the winter?
Mr. Rajasai, you must understand I am nobody to question the authority of Honorable Health Minister of Delhi State. I'm a physician. and I can say about the data, but I'm nobody to challenge or question
what does
the
what
statement
does
made
your
by the
data
Honorable
suggest?
Health Minister of Delhi State.
What does your data suggest?
See, as per data, as your channel itself has shown, that we are facing after 26th of October, high surge of daily COVID cases in Delhi city, or because Delhi has been the NCR, which patients come not only from Delhi local domiciles, but patients from neighboring states, neighboring districts. They keep on flowing to Delhi city, and Delhi has got a lot of flowing population, which population comes in the morning for the work, then go back to their states or their hometowns in the evening. So it is that population which is also giving trouble. And as you are aware, we are passing through a very festive phase, and in festival phase, a lot of people gave up the social precaution, social distancing, use of mask, did not clean their hands thoroughly and properly, and came in very close contact with strangers or persons whom they never knew, like a shopkeeper. In a shop, there were 20 people standing. Your channel also showed it, that in a shop, a small 10 by 20 shop, there were 30 people crowded for buying for some commodity. They do not know the next person, next lady, next boy, next person could be having COVID.
So you're saying,
and they got transmission from that.
So you're saying
expected lines.
No, but are you not worried that, you know, if this continues, does Delhi have the infrastructure, the ventilators, the ICU beds to cope up with the situation? Yesterday, the Home Minister had to call the Union Home Minister had to call an emergency meeting to ensure that adequate facilities are in place. Is Delhi prepared for this sudden spike?
Exactly. Sardesai Sahab, you see that how much government is concerned from the highest level, Honorable Prime Minister. The Health Minister itself on a vacation day took a huge meeting, called for all the senior people who are involved, and tried to reconsider how can they improvise the situation. And they are taking all the effort at war footing. I must remind you that in the Health Ministry, there is a war room in the office of Honorable Health Minister, which is operational almost 24 hours a day for last 8 months. And only because of that, and Honorable Health Secretary and Health Minister are putting all their attention to how to prevent this COVID infection. If somebody has got the COVID infection, how to treat it, how to bring the best medicines, how to bring the best beds. And Honorable Supreme Court is also monitoring it. And during June also, there was a huge survey conducted in Delhi, and you saw the results. But now this surge is because of we are lacking. We as a citizen of the city are not doing the social obedience. In that manner, we are not maintaining social distance. We are not using mask. When we are going, we think that mask is a taboo. There is nothing like taboo. If Honorable Prime Minister of the country is wearing the mask, if Honorable Home Minister is wearing the mask, Health Minister Sahab is wearing a mask, why I and you cannot wear the mask? Then we are going out of the house, out of the home, just like that. We're having fun or chilling out.
So you're
that
saying,
is causing the biggest problem. You must remember, prevention is the treatment of COVID.
Okay, I think that's those are salutary words.
Today's vaccine is social distancing.
Okay, those are salutary words. I hope they are being listened to by our viewers out there. And what you seem to be suggesting is that the Delhi government is prepared for this emergency situation, and there is all precautions are being taken. We'll wait and see in the weeks ahead. Thanks very much, Dr. Verma, for joining me here.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.